يا زيني هم النسيم والليل بواب ظلامه له قمرة في سماء.
يا زيني هب النسيم والليل بواب ظلامه له قمرة في سماء.
يا زيني هب النسيم والليل.
Bismillah ar-Rahman ar-Rahim. Jazakallah for the invitation to come and speak to you this evening. I've been asked to say a few words regarding the traditional or the conventional understanding of mental illness as it is in the West and the UK today. And I'm going to talk a little bit first of all about the attitudes towards mental illness, which cuts across all sections of society, but I believe are particularly prevalent in some ethnic minorities, certainly in the Muslim community as well. Then I'm going to just talk briefly about a couple of major mental illnesses you might have heard of, depression and schizophrenia. And then I'll touch at the end very briefly on my basic understanding of jinn possession and the interface. But I must emphasize I'm not a scholar, and certainly I'm sure we'll be hearing more from Sheikh Talib later about these matters. Before we start, and I understand we're looking at it from a Muslim perspective, as Brother Abu Isa said, it's important first of all to accept and acknowledge that not all changes in emotional state are abnormal and can be defined as illness. And I was thinking, what should the normal mental state for a Muslim be? And as we all understand, we all believe in the hereafter, we believe in the punishment of the hereafter and the punishment of the grave. Hence, you would think it would be normal for a Muslim to feel anxious about that. So a state of anxiety to a certain level is actually normal for all Muslims. So to be free of anxiety completely, you have to say from an Islamic perspective, is actually abnormal. So from that perspective, it's important to recognize that not all symptoms of anxiety and depression can be viewed in an illness framework, in an illness kind of concept. And that's important to remember. Now, having said that, there is no doubt, certainly from my perspective, that mental illness exists across all communities. Being a Muslim does not protect you from developing these kinds of illnesses. Across society overall, there is much stigma against these kinds of illnesses, much discrimination. The word stigma is from a Greek word meaning a mark, something which marks you out as different from other people. And the problem in mental illness is that there are very strong negative public perceptions about mental illness which influence all our thinking and can also, more importantly, affect how we or our friends or family seek help for these conditions. I want to go through a few of these misconceptions and talk very briefly about them. The first is that mental illness actually doesn't exist at all. We accept physical illnesses because we can see them, we can measure blood tests, we got x-rays, but we can't do the same in mental illness, so therefore, does it really exist? Well, studies have shown that about 1 in 4 of us will have a mental health problem at some point in our lives. And that's actually quite a surprising figure because people often underestimate this in various surveys across all kind of ethnic groups. So that's something to bear in mind. And of course, certainly in the Western world, data collection is quite good, and we've got quite good hard evidence of the kinds of problems people present with and can record incidences and frequencies of conditions. When we consider this concept of does mental illness exist, it's important to remember that it's not a simple dichotomy between physical illness and mental illness, that the two can often coexist together. And nobody is seriously questioning the existence of physical illnesses. So, for example, someone with a chest infection can become confused. Someone who's had a stroke due to a blood clot in the brain can become confused. Somebody with a deficiency of vitamin B can become depressed. There is a a hormone in the body called thyroxine, which regulates the body's metabolism, body temperature, heart rate, things like that. That can become low in the body for no apparent reason sometimes, and that can cause depression. If you have a brain tumor, that can cause epilepsy, can cause depression, can cause more severe mental illnesses. So if we look into these things, we see that the matter isn't clear-cut, because no one's denying the fact that, you can't have low vitamin tablets or you can't have strokes and things like that. So the two do interact quite closely sometimes. And it's important to bear that in mind. So the idea that mental illness doesn't exist doesn't really hold up, I believe, to reasonable evidence. Another thing is that mental illness can't be treated. Once you've got it, that's it. There's no cure. And again, that's not true. Indeed, the majority of mental health problems are either treated, and when I use the word treated, I mean it in the widest sense, not necessarily by just medication. Sometimes treatment, all it needs is little time, little support, little counselling, maybe from family, maybe from friends, maybe from the imam, maybe from somebody else you know. Or it may involve a change in lifestyle. It may be, as the Sheikh mentioned, drugs and alcohol are major problems. It may be avoiding those things. It may be sorting the family or marital problems out. So it doesn't necessarily mean you have to go to a doctor or a psychiatrist or psychologist. But even with the more defined mental illnesses, the ones that need formal treatment, there's a lot of research which shows that with medication, with therapy, these illnesses can be cured. And certainly that's something to also bear in mind. Another area is that mental illness really is due to one's own deficiencies. It's due to a weak personality. If you get it, it's basically your own fault because you're not strong enough to withstand the stresses and strains of life. They do various surveys from time to time. A recent survey of about 2,000 people asked people to look at some statements about mental illness and say whether they agree or not. And one of the statements was one of the main causes of mental illness is lack of self-discipline and willpower. And about 15% of people agreed with that, essentially saying, well, it's down to you if you get it, if you get depressed, basically. And what was interesting, I thought, was that they broke this down by social class, and they found if you looked at the lower social classes, that figure rose to 50%. 50% of people believe that one of the main causes of mental illness is lack of self-discipline, which suggests that there's an education effect here as well, that people who are educated and understand actually have a different perception of mental illness than those who are not. There's also attitudes, again, in the media that mentally ill people are violent by nature. If you get a mental illness, you're dangerous in some way. You can't trust people. They are, not to be trusted. Unfortunately, of course, this is heavily influenced by media reports, which gives a kind of a false impression of mental illness. Now, the facts are that most mentally ill people aren't violent at all. There is a small proportion with a certain type of illness that have a higher rates of violence, slightly higher, but the vast majority of violent crime in this country isn't committed by mentally ill people. But of course, the one case there is the headline news, on the 10 o'clock news, is the headline, basically. And you don't hear about all the other violent acts and murders which are going on day in, day out. So again, that's something to bear in mind. But that's also important because it influences people's attitudes to mentally ill people. And it also influences people's ability to actually seek help because they're worried about how people will perceive them or even disclose their problems to a friends, family, or their employers sometimes. Finally, the idea that, well, mental illness is something, yes, we see in this country, but it's actually a Western concept. Doctors have been trained in this country. It's something that affects the kuffar. It's something that affects people who live in the West, the affluent West, the decadent, etc., etc. Well, that's quite interesting because certainly there's a lot of worldwide research which shows that rates of mental illness are actually very similar globally. Of course, the presentations actually are different. They are determined by cultural, religious, ethnic factors, as it were. But there's no evidence to show that it's simply a Western phenomenon. It's interesting that there's been a lot of research across countries, and people who've been trained in both different countries, moving backwards and forwards and doing research with each other. And so, for example, the depression rates in the UK were compared with Rawalpindi in Pakistan, and they're found to be very similar. And interestingly, they also compared the depression rates in a rural village just outside Rawalpindi with depression rates in the city itself, and found the actual rates in the villages outside were higher. So this idea that, well, it's all to do with Western lifestyle, inner city life kind of thing, and people living in the mountains, of the Himalayas don't get depressed is actually false. They have a different set of problems, and there are different reasons why they're depressed, but they are depressed. And the research, actually, interestingly, is quite good in the sense that these are people who've been trained to obviously ask questions which are culturally acceptable in the right language and have been validated with research instruments. So the evidence is actually quite good. So why am I telling you all this? Well, all this is important for one real important reason, is that all this kind of evidence and perceptions has a big effect on people who develop mental health problems. Because if you can imagine for a minute how you would feel if you were the person who developed depression or anxiety or something like that, with all this around you, and I would certainly say that some of these perceptions are probably more prevalent in our communities than they are in the general community, what would you do if you had a mental health problem? Would you tell anybody? What do you think they would think about you? Do you think they'd have this attitude towards you? Would they not want to talk to you or stay away from you or perhaps tell other people? Even if you went to seek help, what would your GP think of you? What if you got an Asian GP who knows your father or uncle and lives around the corner? So there's this big problem I think we particularly have in our communities about stigma and attitudes to mental illness. And part of it is our own perceptions, and some of it obviously affects how people seek help. And sometimes, of course, they don't seek help, which is the tragedy, and things get worse. And other times they will seek help through other routes. And I'll come on to this when I'm talking a little bit later about jinn possession, because we know there is something of an alternative healthcare industry in the UK, which deals with these things outside of the mainstream health services, and is particularly prevalent in people from African and Asian cultures. Moving on, there's no time, obviously, to go into all the different types of mental illness, but I want to just touch on a couple which you may have heard of. The most commonest one is probably what we call depressive illness or depression. One of the difficulties here, I think, is partly the terminology, the words we use. Because the word depressed can mean different things to different people. We all get depressed, yeah? If we have a bad day, we get depressed. But that, of course, isn't mental illness. Otherwise, we'd be treating everybody, virtually all the time. Now, depression as an illness is something completely different. It's something which is beyond the normal fluctuations in mood which we all get. And in addition to feeling low, there are lots of other symptoms which we as psychiatrists and as GPs and psychologists use to diagnose these conditions. So it's more than just low mood. People can feel very, very tired. People can actually physically lose weight, lose their appetite, have difficulty sleeping, have poor concentration, and other symptoms as well. So it's all these symptoms, not just feeling a bit down, which we will rely on to make that kind of a diagnosis. Again, I think we will touch a bit more on treatments maybe in the question-answer sessions, but broadly speaking, depression is a perfectly treatable illness. There are combinations of treatments. I mean, I think I've already mentioned you want to treat the causes sometimes, and the cause, as the Sheikh rightly said, may be drugs, maybe alcohol, maybe your work and things like that. But leaving those to one side, there are antidepressant medications available, there are types of therapy available, which are effective and will be effective in the majority of cases. There are, of course, some people who will not get better, but you could say that of any type of illness. There are people with arthritis who will never get better. There are people with chronic chest problems who are chronic smokers who will never get better. So mental illness is no different from other medical specialities in that we have people with mental illness who will not get better. So it is no different in that respect. Now, the other big area of mental illness, and I think people see this area as when they think of someone as insane or mad, is the area of psychotic illness. And of the psychotic illnesses, by far the biggest one is something called schizophrenia, which you may have heard of. Now, what is a psychotic illness? Well, that's a mental illness where there is a big distortion in two things. One is in how we think, and a distortion in how we perceive the world, in perception. And common symptoms include things called hallucinations, which basically usually are called auditory, i.e. things we hear. So people will hear voices. People will hear voices just like I'm speaking to you now when there's nobody around. So basically it's someone talking to them. The other big area of symptoms is what we call delusions. Delusions are false beliefs which are not in keeping with the person's cultural or religious identity. So, for example, if you went to an atheist psychiatrist and you mentioned you had angels on your shoulders recording your deeds, the psychiatrist wouldn't say, well, I don't believe in God, all these things, therefore you're mad and I'm treating you. He would actually go and do some, if he was any good, certainly, look at these issues and say, actually, this belief is in keeping with your religious culture. Therefore, it is not regarded as a significant symptom at all, and is not, doesn't come into the realms of mental illness. Now, living in this society, it's actually quite interesting, because as a psychiatrist, it's not that easy sometimes to define what is a delusion and what is not. So, what is a false belief, or what kind of delusions are there? Well, common delusions include being followed, being spied upon, being watched, being persecuted, being killed. So if you came to me and said, Dr. Amin, when I go to Manchester City Centre, I feel there's cameras everywhere watching me. Is that a delusion? Well, clearly there isn't, because there's loads of cameras. In fact, Manchester City Centre has one of the highest numbers of CCTV in any city in Western Europe. So clearly that isn't a delusion. Is it possible you might be being followed or being photographed? Well, certainly in today's age, with the political climate we're in, I'm sure a lot of us are having our emails intercepted, our phone messages tapped, and et cetera, et cetera. So, you have to look at the context in which people are expressing beliefs. And it's quite true that many people in this country who are asylum seekers have come from different countries in the world, where obviously there are police states and people do spy on each other much more regularly than this country, often talk of these kinds of symptoms, ideas, as being perfectly normal, and certainly well within the cultural context of where they're coming from. So it's not always easy to define what's a delusional belief and what isn't. Now, obviously, if someone tells you, well, there's Martians actually have planted a silicon chip in my tooth, which is controlling the BBC, that's a bit more clear-cut, isn't it? There's not much doubt about that person is in need of urgent treatment. But generally speaking, sometimes it's not very, very easy, and we have to understand the cultural background of the person before we try to understand what is illness and what is other experience. One of the other interesting areas of overlap here is obviously religious beliefs, full stop, whether they're from Islam or other religions. And here, it is difficult for everybody, because obviously if you're not from the same faith group as the person you're seeing, you might have difficulty in understanding the person's, viewpoint, and whether their beliefs they're holding are in keeping with the person's religious ideas. I remember I saw a Pakistani man in a police station here a few years ago, and he was picked up by the police as acting oddly. The police have powers to pick up people off the streets, interestingly, those they deem to be acting oddly or strangely, and actually take you to a police station and get you to see a psychiatrist. So beware of that. I was on call. I saw him with a social worker. Just explain the context. In this country, there is something called the Mental Health Act. So you can be forcibly admitted to hospital against your will if you are deemed mentally ill and a danger to yourself or other people. But to do that, you have to have assessments by several people, at least 3. So usually a psychiatrist, a GP, and a specially trained social worker. So I was there as a psychiatrist. There was a social worker and a GP with me. The social worker was a Christian and the GP was an atheist. And this man was, well, so he certainly, you could say he was a devout Muslim in the sense that he spent a lot of time praying with the Quran, and he had some problems with his wife because his wife complained that he was becoming quote-unquote too religious and actually neglecting his family duties. But he had some unusual ideas, and I was having difficulty actually determining whether actually he was ill or not. Interestingly, he started off by, well, one of the things, first thing he started was, he actually recited a verse of the Quran and asked the social worker, what does that mean? He said, well, I'm a Christian, I don't know. He said, I'm not talking to you. Then he asked the GP, what does it mean? And he said, I'm an atheist, so I'm definitely not talking to you. Then he asked me, and I think, well, I gave him a brief explanation. Well, that's nonsense as well. You don't know what you're talking about either. I'm not talking to any of you. So he was completely focused on religious matters. And I had great difficulty in understanding. And then he started talking about going to Pakistan and taking his father for Umrah. And he started talking in a way which suggested that he knew this would happen in the future, that he had the ability to foretell the future. And he started talking as if he was a prophet. And at that point, I knew that, well, actually, this is now beyond the bounds of Islam. This guy actually is quite ill. So it does take a bit of time sometimes to actually work out where someone is on that spectrum. Another example was a Catholic woman admitted to our hospital recently. She was found praying by her son in a completely mute state at home, motionless. And he couldn't rouse her, he couldn't talk to her or anything, and he didn't know what to do, so he called the ambulance, and they carted her off to hospital in this state. And she spent about 24 hours in this state and suddenly woke up and was amazed to find she was in hospital. She thought she was at home. And, you know, talking to her, she couldn't recollect anything about, you know, what had happened to her. And she was fine. I mean, and she just went home, basically, after that. So again, a perfectly understandable religious experience within her religious kind of boundaries. Just the final few minutes, I just want to say a few words about one of the topics we're here to learn about today. And again, I emphasize I'm not a scholar, but in terms of jinn possession, we'll be hearing more about the symptoms of jinn possession from Sheikh Talib, but there's no doubt that some of the symptoms of jinn possession actually overlap quite a bit with symptoms of mental illness. And indeed other types of illness, so illness called epilepsy, people have fits. Sometimes it can be very difficult to distinguish from that as well. So for example, symptoms like just generally feeling unwell, having mood changes, feeling depressed, headaches, confusion, these are general symptoms which can be due to a whole host of conditions. But there are some symptoms, I think, which are more unusual. So for example, things like staring without blinking, speaking in strange voices, speaking in strange languages. These are more unusual. I'm sure Sheikh will elaborate upon them later. One of the things I would say is my understanding is that the interaction of jinn and humans is relatively rare. So if you look at the frequency of mental illness, it cannot be that jinns are causing all mental illnesses. Otherwise, you know, it would be an absolute epidemic. But certainly in our communities, I think there is, and I think the Sheikh alluded to it as well, that virtually everything sometimes is attributed to jinn, because we've got no other explanation for it. It's almost a default position. Yeah? So, you know, the Sheikh gave the example of hay fever. I mean, you know, any illness we have, it must be due to jinn. And there is that problem in our communities that we can't think of anything else apart from jinn causing things that we can't explain and causing things related to illness. And I mentioned before, and again the Sheikh alluded to it, that there is an alternative healthcare industry in this country, and indeed other countries as well, of people who call themselves beads, hakims, and other people who really have little knowledge, true knowledge, of how to deal with these issues. But of course, people are vulnerable, they're desperate, and they don't want to go and see their GP or psychologist or psychiatrist for the very reasons I've just mentioned. And you've all seen some of the adverts for these people in traditional papers, you know, be it Salam Baba sitting in Birmingham or London who will cure you of your marital problems, your impotence, your depression, your diabetes, everything in one go. You know, for a fee, of course. And And the problem is that many people will tend to go down this route without actually understanding what they're getting involved in. I don't do any private work, but I remember I was asked to see someone privately a few years ago. And he was a young man, 21-year-old Pakistani guy, brought up in this country, educated, university degree. And he came to me because he was feeling depressed and he thought he was possessed, and he'd been to see numerous people all over the country. And he'd spent thousands of pounds, I forgot the figure, it was a ridiculous figure, about £5,000-6,000 on these, basically amulets and charms and this and that. And I talked to him, and again, I confess I don't have all the knowledge, but to my understanding, he had a fairly straightforward depressive illness due to some family problems, as the Sheikh alluded to. Nothing particularly exciting, and something I thought could be treated reasonably easily. So this man, who was educated in this country, not someone who's uneducated and off a boat somewhere. This man from this country, as it were, had spent thousands of pounds getting virtually useless treatments, really, which was actually quite surprising for me to certainly open my eyes to how, if he could be going down this route, goodness knows how many people who are not educated are actually going down this route. And the other thing, of course, when looking at these people, who give taweez, and as the Sheikh said, even without the Quran written on it, Allah Ta'ala said the Quran is a shifa for everything apart from death. The shifa is there. These things, the most cures and protections against jinn aren't hidden. They're not secret. They're in the Quran. Surah Nas, Surah Al-Falaq. These things are the best protectors. And the Shaykh again mentioned that people come to him who have very, very little faith and don't pray and do all the other things and expect people to actually give them amulets and taweezes and things to make them better. Whereas what they need to do is look at themselves, first of all, and try to strengthen their iman, because that is the best protection against jinn. So again, this fits in to the idea that people have this concept that all they need to do is go to their Pir or their Hakim, and he will do something to them which will make them feel better. And there is this kind of ideology, which is sad, I think, that people don't fully understand, even the most basic things about Islam and what our deen says. I'll finish off finally. We've talked here as if there is, the issues have been delineated by Brother Abu Isa very well, in that we are talking, about jinn possession on one hand and Western illness on the other hand. But in terms of treatment, I would say that there's no reason why we can't have a dualistic approach. We can't do both. If you, say, had a relative with a head injury, and you took them to hospital, the doctor there wouldn't say to you, well, okay, they've got a blood clot in their brain, now we can either take them to theatre and operate, or you can do dua for them. Yeah? So you've got a choice. That's ridiculous. You say, well, we want both. We will do dua, but we want the Western cure as well, the tradition. So in a sense, there's no reason why mental illness cannot be treated with conventional medication and you can do dua. Indeed, I would advocate that route to be, in a sense, the best of both worlds, because the two often do not conflict with each other. I remember, when I was a junior doctor, seeing a man, I was in Nottingham at the time, an elderly Pakistani man who had a lot of medical problems. I think he had diabetes, he had heart problems, he had suffered strokes in the past. And I saw him, he was on the first floor of his house, and he was about 60, 65. And he was obviously mentally unwell. He's acutely confused. He was seeing snakes and lions and trying to climb out the window, and really it was in a bad way. And he could have had a whole host of problems wrong with him. My guess would have been that his diabetes was out of control. He might have had a small heart attack. He might have had pneumonia. He could have had a whole host of medical problems causing his confusion. But clearly he needed to be in hospital. And I remember at the time his wife was there, and two sons, again, who were similar age to me, brought up in this country and Western educated. But when I suggested that he come into hospital, they were very against this, and I couldn't understand what this was about. And they had a kind of mini family conference kind of thing, and they were kind of talking amongst themselves. Then they said to me, look, okay, we'll bring him to hospital later on, but we've got to take him, we were living in Nottingham at the time, we've got to take him to Birmingham first. I said, what do you mean Birmingham first? He's acutely ill, he needs to go to hospital now. And they said, no, we've got to go and see our Pir, basically, yeah? And I said, okay, look, there's no way I'm allowing this man to be put in a car down the M42. He's trying to get out the window, the first floor bedroom window. And what are you going to do if he tries to get out on the motorway? And they just didn't understand this basic thing. So and I said, look, I have no problem with the Pir Sahib coming to Nottingham to see him. What's wrong with that? You can do dua for him and the rest of it kind of thing. So again, people have this view that, you know, they have to go for one or the other. So they said, okay, we hear what you're saying, but we'd go for our Pir first of all before you start looking at his diabetes and the rest of it. So again, it's about knowledge and about the power, I think. I'm always quite surprised by the power that these beliefs have in our communities, even amongst people who have been educated in this country. With that, I think I'll finish. It's nearly 20 past. I'll hand back to Brother Abu Isa. Jazakallah.